Studies have shown that over 50% of people without pain, in other words, they're asymptomatic, they have
Hmm.
positive disc bulges in their back.
Hmm.
So, in other words, they really have the bulge based on the fact that it has a high sensitivity and it
Yeah.
has a high rate of true positives. But the problem is that that bulge isn't necessarily causing the pain. Okay. It definitely has a lot of value, but it doesn't
Yeah.
necessarily tell us that bulge is actually the cause of pain because over 50% people have a bulge without pain.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to episode 10 of the Optimal Health Guide. I'm Michael, your host, and I'm here with Josh Vance, the Optimal Health Guide. Josh, how are you doing this week?
Great. How are you?
Hey, doing quite well. So, Josh, today we're going to hit on some diagnostic tools that you use, which we've already laid a good foundation for it. I'm hoping to really dive deeper and to really show listeners why treating pain without understanding the root cause often can lead to frustration or slower recovery. And I'd really love to have you dig into how advanced diagnostics can help you to treat the real problem. One of the things, with episode 10 in front of us that I'd love to add into our repertoire as we keep moving forward is to utilize listener questions. We've already received a couple of questions, but I would love to prime the pump. You're listening to this episode. We want this podcast to be a source that actually speaks to what people are really dealing with in real life. And so if you have a question, whether it's about pain or recovery, movement, or something that you've been struggling with, we'd love for you to send that in. You can do that at podcast.vancept.com. We read every submission. We'd be willing to use many of them in an upcoming episode or batch them together and have a whole episode dedicated to listener questions. So love to have you jump in. You're listening in and submit a question for us. So let's dive right in, Josh. So with today's topic, you've hit on some of this already about guessing about where the problem is coming from. And you've done a really great job of helping us to get the idea that you want to get to the root cause. But why, let's just start here. Why is guessing about the cause of pain such a common problem in healthcare?
Well, today's healthcare environment's challenging, and I've kind of got, I think, about three or four, maybe four different thoughts or possibilities, causes.
Great. Yeah.
One cause for that could be that there's not enough time with the patient to figure it out. In a healthcare environment today, sometimes time is very short, and so
Yeah.
with the limitations with insurances and just all the different stuff that we have to deal with, sometimes time is an issue. And, it takes a while asking questions and it takes some time to kind of do some different
Yeah.
testing to figure out what might be going on. I think another possibility is that a patient could be a poor historian. In other words, they're not giving good information that's sufficient enough to create a good differential diagnosis. And what a differential diagnosis is it kind of like I always tell my students, it's a laundry list of the top three or four things that you think could be going on. And then you're trying to rule in or rule out so that you've kind of selected the top one. And that's what you're going for. Now, I don't think this one is as common as maybe some of the other questions, but
Mhm.
sometimes people have a hard time explaining what their pain feels like. They have a hard time explaining what they're experiencing.
Yeah.
And so that can have an impact on coming up with a good understanding of what's going on.
Yeah, let me jump in there for those
Sure.
first two that you brought up. That makes sense. Time, we live in such a fast-paced culture that, we'll use that maximum time as money. So that makes sense. And I can see the way that that would impact the healthcare industry as a whole, that if you're running up against the clock, we've got to get this figured out. We don't slow down. Which is what it sounds like is really required. The second one that you brought up about poor historian, that's a really interesting one. I think I would be a patient that would fit this because you had talked about kinesthetic awareness. And I think it's something that I've not always had a lot of. I've seen it, especially because my daughter has such strong awareness about what's happening in her body. And I've almost marveled at it like a superpower that she carries. And so that makes really, really good sense what you're describing there with those first two. So either respond to those or feel free to continue on to number three.
Yeah, I think, kinesthetic awareness and everybody else has different strengths and weaknesses. And some people have a hard time just describing their pain. They can't identify if it's sharp or achy, if it's dull, burning.
Yeah.
And different cultures explain it differently too. Like I have a really difficult time with some cultures, everything's just pain and trying to get the quality of pain can be sometimes frustrating actually. So another possibility could be lack of knowledge, experience, or understanding. And what I mean by that is if the person in healthcare is perhaps newer, they may not have a whole lot of experience given certain problems and diagnoses.
Yeah.
They may not have a knowledge on something that may be kind of rare. Sometimes we get some rare things here in physical
Hmm.
therapy. And, if you haven't come across it before, well, the first time's always a bit a big
Yeah.
once you've seen it once, then it's a lot easier to pick up on the second time. And sometimes just understanding, not having a good enough understanding as to what is completely going on or what they're really struggling with. That can be another possible cause for
Yeah.
kind of guessing about things. Probably the fourth one that I can think of is not enough testing to rule out the underlying cause. And
Okay.
sometimes this can be from insurance limitations. The insurance may require that
Yeah.
you can't go get this test because you haven't done something else yet. You can't go get this procedure because you haven't done this yet. So sometimes it's
Yeah.
insurance limited, but not always. Testing can have a very valuable
Yeah.
outcome from that test that really helps to rule it out. But also, if a person doesn't have the ability to do the test or the knowledge to do certain
Mm.
tests, then obviously that's going to be a limitation as well.
Yeah. Well, I can see why people are in such good hands as they come to you. With 20 plus years of experience, you're going to have a wide level of expertise and practical knowledge about dealing with situations that people are facing. And again, I think that's going to help us. I'm hoping that as we continue the conversation, you'll dive further into some of the diagnostic tools that you have available to yourself to be able to dig in a little bit further. Anything else you want to address there before we get into the second question?
No, I just think people understanding the value of the diagnostic tools is very important, definitely.
Yeah. Well, let's look at question number two. And I'm wondering too, I just know that as I was trying to figure out how to be able to navigate this conversation, I'm wondering if this is in some ways even an inflammatory question or topic. So let's see where we go from here. So why can imaging like MRIs or X-rays sometimes show problems that aren't actually causing the pain?
Yeah, that's a good question. It's an interesting question, in fact. And so we're going to have to kind of educate everybody here a little bit about
Let's do it.
testing. So there's these two things called sensitivity and specificity when we're talking about really any kind of test. And it can be some
Okay.
manual tests like a Tinel's or a Phelan's test, but it can also go into like, for instance, MRIs. All right. So let's talk first about a little sensitivity, and that is the ability to correctly identify individuals who have a specific disease or condition. So it's expressed as a percentage of true positives, right?
Okay.
So a highly sensitive test or a true positive has a high true positive rate. And so it would have a low false negative rate. And so that
Hmm.
makes it ideal for ruling out diseases when when the result is a negative.
Yeah.
And this is like MRIs have high sensitivity to help rule out diagnosis. And the sensitivity is like 51 to 95%, depending on, for instance,
Okay.
like rotator cuffs. Okay. So depending on what kind of rotator cuff. All right.
Yeah.
That's the sensitivity part. Okay. This is kind of a long way around that question, but we have to
Yeah.
understand
That's
a
all
few
right.
things. All
Yeah.
right. Now, specificity, on the other hand, is a test that is able to rule in a particular diagnosis. In other words, there are very few false positives. So, a high
Mhm.
specificity test rarely gives positive results in people. Okay. That would be a bad thing if you had a positive result when you really don't have
Okay.
it. That could lead
Yeah.
to unwanted treatment. We don't want that. So,
Yeah.
specificity is a very important thing. So, let's go back to kind of the MRIs. Because they have a particularly high sensitivity, studies have shown that over 50% of people without pain, in other words, they're asymptomatic, they have positive disc bulges in their back.
Hmm.
So, in other words, they really have the bulge based on the fact that it has a high sensitivity and it
Yeah.
has a high rate of true positives. But the problem is that that bulge isn't necessarily causing the pain. It doesn't tell us what's causing the pain. It has
So
more to do
interesting.
with other things. Okay.
Yeah.
It definitely has a lot of value, but it doesn't
Yes.
necessarily tell us that that bulge is actually the cause of pain because over 50% people have a bulge without pain. So those findings of the diagnostic test need to coordinate with the complaint and all the other physical findings that make sense so that either yes or no, this really does look like this is coming or isn't coming from a bulge or the problem. So all
Yeah.
those puzzle pieces need to fit together. Okay.
Wow.
Now, if a patient comes in with, let's say, back pain, as well as numbness and tingling in the leg,
Hmm.
they have an MRI that says they have degenerative disc disease. So let's say I decide, okay, they have this, they have the numbness, tingling. We need to do an EMG to look at the function of the nerves. In other
Yeah.
words, is that numbness and tingling from an actual injury to the nerves or not? Now, by the way, EMGs have a high specificity of
Okay.
greater than 90%. All right. In other words, very few false negatives. Okay.
Okay.
So let me back up here. In other words, rarely given a false positive that there is a nerve injury when there really isn't. Okay. So
Okay.
let's say I do the test and I find a normal EMG. There's no evidence of any injury to the nerves. So in this sort of a scenario, the nerves could just be irritated, which would, actually make the treatment easier and quicker compared to if there actually was an injury. Right. So these different tests have different values based on sensitivity and specificity. Usually, a test that is higher in sensitivity is a little bit lower in specificity, and vice versa. So we can use them for different purposes, but there still is value. But really, that's why sometimes we have you know, an MRI that shows these problems are positive, and patients always kind of think, "Oh, well, that's my problem." Well, it could
Yep.
be, but it may not necessarily be. It may be that because there's a lot of other structure. It could be maybe muscular. It could be maybe joint. It could be, ligamentous. It could be just an inflammatory condition. So there's a lot of different things that could be contributing to those particular symptoms.
Okay. Well, you explained quite a bit with the MRI, and before I dig further into that, talk a little bit about X-rays because here's where I'm coming from. Josh is like as a person without the training that you have, I think, wow, if I were prescribed to go the route of getting an MRI or to get an X-ray, those are the best of the best that I could be looking at. But you're really helping me to understand because of the specificity and the sensitivity that I may not get the right information to deal with the root cause on the other side. So use some of that same language that you've already described with MRIs, but just tease out the X-ray if you don't mind a little further.
All right. Well, X-rays are more basic. Basically, they're showing the bone. MRIs are going to show a whole lot more. They're going to show, muscle. They're going to show nerves. They're going to show ligaments. They're going to show some things that you don't see, the discs. They also kind of show bony a little bit, but the X-rays are fairly limited to bony situations. So you can see, yes, I have a fracture. No, I don't have a fracture. Yes, I have a osteophyte or a extra bony growth on my heel that's causing some pain when I'm walking. Now, as far as sensitivity and specificity, I don't have
Okay.
the percentages of that.
Sure.
But certainly, X-rays are the basic thing. That's kind of the first
Mhm.
thing providers are generally going to do, and then later down the road, the MRIs come in. So,
Okay.
you may have an X-ray that's normal, which is very common. All right.
Mhm.
And yet that really doesn't explain why I have the pain. Okay. So that's why there's other testing to kind of differentiate that.
That's great. Okay. Yeah. So again, like I had said before asking this question, I was wondering, like, I guess this question alone already and some of the answers you're getting at disrupt some of my thoughts because I feel like, well, wait, I want to go the route of an MRI or an X-ray. So why don't you fill in the gap here with this next one? So how do tests that are in your tool belt, like EMG, nerve conduction studies, musculoskeletal ultrasound, help you to see what's actually happening?
Okay. So as I mentioned earlier, EMGs really indicate the function of the nerve, whether or not the nerve is injured. If we have a positive, we have some nerve injury. Okay. If we don't, hey, we have normal nerve function. Sometimes patients are frustrated with that. Well, if it's normal, why do I have these symptoms? Well, it's something else, but this is good. We do not want injuries to the nerves. But with the EMG specifically, we can learn the location of the injury. We can kind of what kind of a nerve could be injured. For example, a sensory nerve that gives you feeling versus a motor nerve, which gives you strength. We can learn a bit about the prognosis from understanding what part of the nerve is injured. The test is
Mhm.
amazing as far as the information because we can identify if it's an injury to the outer part of the nerve, which is called the myelin sheath. That is the
Mhm.
conductive part of the nerve, kind of like the insulation on the outside of wiring versus
Yeah.
the axons. That's more like the copper wire. We can see the difference between the two. So injuries
Mhm.
to that's more like the wire. The axons are more like the wiring. Okay. So injuries to axons are going to take a lot longer to heal than an injury to the myelin sheath. All right. So we can also learn about the severity of the injury and sometimes how long the injury's been present.
Wow.
And as well, in some cases, whether or not the body shows signs of reinnervation or not. Okay. So we can see an amazing amount of information from this, as well as what's actually going on in the nerves, as well as what's going on in the muscles, too. Okay, so it doesn't just check for nerve injuries, it actually is also potentially looking for muscle disease as well.
You used a word there, and I'm not clear on it. Reinnervation, if I'm hearing it correctly. Dig into that a little bit more and what that would
Okay.
mean.
Yeah. Reinnervation is your body trying to heal itself. Okay. So when we have a denervated muscle for whatever reason, an injury to the nerve, okay, we're looking at the muscle that is innervated by that nerve. There's
I
two
see.
ways we heal. One way is from direct reinnervation. That is basically where that nerve basically kind of breaks down and then it has to rebuild over time. That's a
Yeah.
slow process, all right? Now, the other way is called collateral sprouting. And so when we have injury to a nerve, there's actually chemicals that are released which attract nerves that are near to help them
Wow.
go to that that injured part to help reinnervate it. And the collateral sprouting is a lot faster to happen than the direct reinnervation.
Wow. That's amazing. I'm glad I asked that. Again, I'm just blown away at, the ability that the body has and the way that you're cooperating with that or discovering it. I'm also blown away too at, again, maybe I'm like other listeners who just are unaware of the tools that are available in physical therapy, but these are like magical tools that you have available to be able to really get to the root cause of it. So I continue to be amazed at the powerful toolkit that you bring to the table. Anything else you want to address there about my response before we move into just some examples of what this might look like?
Yeah, so let me talk about the MSK ultrasound. Okay, so that stands
Okay, yeah.
MSK stands for musculoskeletal. So it's musculoskeletal ultrasound, and that is applied to what we call the peripheral joints. So peripheral joints include joints such as the shoulder, the elbow, the hand and the wrist, as well as the hip, knee, ankle, and foot. But we can
Okay.
also use it for what we call neuro MSK or looking at the nerves too. Okay. So in an example of the shoulder, we can see a lot of different structures. We could see the rotator cuff tendons. We can see if
Hmm.
there's swelling in the bursa. I can look at the muscles surrounding the shoulder, see if they look normal or if there's maybe fatty infiltration due to
Hmm.
chronic muscle atrophy. All right. We can also look at ligaments to check in. We can also do dynamic testing for things like impingement.
Mm,
And that's kind of unique to MSK because you can't do that in an MRI. You have to be still. You can't be moving. Otherwise, it creates a lot of artifact and
interesting.
you
Okay.
can't see. But there's several things that we can use dynamic testing for to evaluate what's going on in the structure. So let's say I see one of the rotator cuff tendons has some abnormalities that suggest a partial tear. So then I can
Mhm.
focus on facilitating the healing and modify the treatment based on what that tissue looks like in relationship to a healed tendon. And then if I need to, 6 weeks later, we could relook at the tendon and see how it's changing and
Mm.
see how that's responding to the treatment.
That's interesting. Yeah, I didn't quite make the connection there. The MRI, you must be still. I mean, you're in a tube and you can't move, but you're able to then see movement in real time. I can see the benefit that that would bring to the table. If you're ready, give us an example of like how diagnostic testing changed the treatment plan completely because now you have new information.
Okay, so the gal that came in for shoulder pain with some diffuse numbness and tingling, as well as a bit of weakness in the shoulder. And I was kind of thinking that this could be an issue with the rotator cuff or possibly coming from her neck. Wasn't quite sure. So we started with an evaluation, some therapy, and shortly after the evaluation, I did an ultrasound on the shoulder, which was pretty normal. Not a lot going on there. So that really helped to clarify, okay, this doesn't really look like this is so much of a shoulder issue. So then we eventually did an EMG, and that showed that they had a pinched C5 nerve in the neck that was causing her symptoms. So then we started working on her neck to try to resolve the symptoms. Right? So that was an interesting case. Uh,
Wow. Close the loop there. So you started working on it, and then how did that situation resolve?
well, they're still in the process.
Okay.
They're being referred back to their primary care for an ultrasound and to see a specialist also because they're still having some significant weakness and problems that's not progressing like I would like to see it.
Okay, I see. Wow. Yeah, that's amazing. I was just thinking you're dealing with one place and you have enough information to know we're in the right area, but yet you find out here's the area that really needs to be dealt with. Amazing. Any other examples that might come to mind for you?
Yeah, I've got a couple others.
Okay.
Quite some time ago, I had a gentleman that came in for hip pain. I'd seen him in the past, but this was new. He was really having a lot of difficulty walking. And so I did the evaluation and then I did an ultrasound on his hip. And his hip was so degenerative, it was absolutely amazing. It did not even did not resemble a hip very well.
Wow.
Anyway, so I sent him back to his doctor to get some x-rays and to see an orthopedic surgeon. He had to come back later after he had his hip replaced. So, I mean, I knew right then from looking at that, this
Yeah.
is not something that's going to get better. So we need to get him through that process, go see the doctor, get the boxes checked off so he can get a hip replacement.
Wow. And so helpful so that you didn't waste time dealing with trying to diagnose and figure out some other way. You were able to clearly understand the route to take. Has that person had that surgery? And do you have any information on the other side or that
Oh,
still is in process?
yeah. So he did have the surgery and wow, what a difference. This game, we went through therapy.
Great.
We did everything we needed to get range of motion, strength, and walking back, and he did really well. This was quite some time ago, but
Yeah.
yeah, and don't if we don't have to waste time. I could work on him for a year, and he would never
Yeah.
be have gotten better. He needed something different.
Wow. That's amazing. It sounded like you might have at least one other example.
Yeah, a couple others.
Okay.
So another example was a guy with numbness and tingling in his fourth and fifth fingers. And this was kind of an interesting case.
Okay.
So I did the EMG and it showed he had two problems.
Hmm.
Okay. He had a C8 nerve root injury and an ulnar nerve injury at the elbow. Now I know that doesn't make a whole lot of sense to most people out there, but I'm just trying to kind of help unpack that so we do understand. Kind of the interesting thing is that this is essentially a double crush injury, both of which present with the same exact symptoms in the same place. So in both
Okay.
cases, we have numbness and tingling in like that fourth and fifth finger and kind of the bottom of the arm. And that happens due to an ulnar nerve injury of the elbow as well as the C8 nerve root. So, I kind of thought maybe it would be one, but it kind of took me by surprise there. I didn't expect
Yeah.
that one.
Okay. So both of those areas result in the same symptoms that manifest. Tell us a little bit about how you had to treat both of those to be able to remedy. And then where is that in the process? Is this an older patient? You've seen the loop closed, or fill in the blank there?
Okay, so this particular case, he ended up having had to have it was very severe. And so
Hmm.
he ended up having to have 2 different surgeries. At first, they did surgery for the ulnar nerve and then later for the neck, and actually we're kinda working with them currently and making some progress on the neck, but it's gonna take a little time, you know?
Wow.
Getting that
That's great.
reinnervation back takes time, and so there's a
Yeah.
lot of weakness and range of motion things that we gotta deal with, you know? With time, we'll get there.
That's great. You're just helping me all the more to understand why physical therapy is such an important part of the healing process. Give us that last one that you had mentioned you have.
Okay. Well, in several cases of shoulder pain, I did that ultrasound and found that the person had a complete tear of at least one of the tendons of the rotator cuff. So that changed the game plan in that, I'm not going to spend a lot of time doing treatment because they need more than we can do. So I had to send them back to their doctor to go see an orthopedic surgeon so that they could get that taken care of until they had their shoulder fixed. Then we could kind of work on that. More recently, I had a gal that had some shoulder pain with limited motion, and I was thinking it was maybe a little bit of a tear possible, but what I found was kind of surprising, and I found some calcification in one of the tendons, and so that kind of
Okay.
changed that game plan. And they're in a phase where it's actually becoming resorptive and progressing. So they're doing really nicely, but I hadn't considered that that could be an issue until I actually saw it on the ultrasound. And I'm like, oh wow, this is pretty different from what I would have anticipated having
That's
to
great.
work with.
You used another word there, and I think context wise, I understand it. So there was calcification you discovered, an additional layer, and then I think you said resorptive.
Yes.
It sounds as if that calcification, again, it's another way that the body was beginning to heal itself. Dive a little bit deeper into there and make sure myself and others are understanding that.
Yeah, there's several several phases with kind of calcific deposits and tendons, but one of the phases is called the resorptive phase, and that's basically when your body is beginning to heal it, as opposed to it, getting laid down. And there's a real painful stage too. We were kind of transitioning out of the real painful stage and working on range of motion.
That's great. Well, this is so helpful. I think these very specific stories just make all of this even more memorable for those that are listening. And I'm sure some people are making connections about saying, like, man, I need to schedule an appointment to get myself in there. How about this with the last question? How does having clearer diagnostic information change the recovery timeline for patients?
Well, I think first of all, that it helps speed up the process overall. I mean, let's face it, when the person has pain, getting better fast as possible is really important to them. I know it
Yeah.
is for me, right? So, in the case of a complete tear, like I just mentioned, they avoided 4 to 6 weeks of therapy that really wouldn't have done a whole lot. They saved
Yeah.
themselves the money from copays, insurance, or whatever. Insurance
Yeah.
saved some money for the system. And then, patient wasn't frustrated. Well, what's going on? We skip right forwards to what they really are going to need. And then we can get them
Yeah.
going after that. Okay. So, other cases, it helps clarify the picture so we can confidently treat the condition rather than kind of attempting to treat something that we might think they have and then having to change and reassess because they aren't improving like we think they should be. And still other cases, it helps to provide the right treatment that's needed, which at times may not be therapy, but maybe surgery. Maybe that nerve is so badly injured, they need something else to decompress it so there's no more
Mm.
compression on it or pinching.
Yeah.
So in either case, the patient's going to win because they're going to get the information that they need in order to guide the ultimate treatment that they need, even if it's unfortunately surgery, but whatever's best for their
Yeah.
particular situation. That's going to give them a little bit of confidence in the treatment and what we're doing to ultimately do what's best for them.
That's so great. And I love the way that you're breaking it down into very practical things. You're going to save on this amount of copays. And it's not just about saving time and getting to healing. It's so many of the other things that happen along the journey toward healing. And so it's just getting clearer and clearer. And I'm sure many of our listeners are understanding why you really are the optimal health guide here, helping people to be guided toward that healing. So, well, if any of you listening are interested in understanding the kind of diagnostic tools that we're talking about today, things like nerve testing and musculoskeletal ultrasound, the best place to start would be a free consultation. You can find that on our website at vancept.com. Feel free to jump in there and find yourself on the journey toward optimal health. Thanks, everybody, for listening in today.